Yes, a very good evening to you tuned into UBC TV. We thank you so much for following all our programs. Welcome back from the news with the Prince himself, Edward Rukidi Kijana Ngoma. And now I warmly welcome you to a special discussion that we're going to hold with the Ministry of Health, of course, to do with health itself. That's their business, and you see, if you see them anywhere in a discussion, definitely they are discussing health. My name is Michael Jordan Lukomwa, and our focus is going to be on environmental health issues. They will give more guidance to that, but that's where our focus is going to be. They will tell us what it is, whatever it entails, and why it calls for this discussion here on UBC TV. I have two officials from the Ministry of Health. I have the Commissioner Health Services, Environmental Health, Ministry of Health. That is Dr. Herbert Navasa on my immediate left here. Doctor, you're most welcome.
Thank you.
And we have Mr. David Katwere Semwanga. He's the Program Manager, Water for People, still Ministry of Health. You're most welcome, sir.
Thank you, Michael.
Yes. So I'll start with you, David. When we talk environmental health, what exactly do we mean, and how useful is it to somebody watching us or a consumer of health services?
Yes, thank you very much, Michael.
Yes.
Environmental health is a branch of public health. Okay. Maybe to simplify this, public health is a branch of health that deals with healthy people. There that we have the preventive side of health or medicine,
yes,
and then the curative side. The curative is where you are sick and you go and seek for treatment and you get healed. The preventive is where you are healthy and you would like to maintain your state of health.
Okay.
So, so that other side is what we call the public health bit, or the preventive side. So environmental health is that branch of that public health bit of health that deals with factors in the environment that negatively affect human beings. And these factors can be physical factors, they can be biological, they can be chemical, they can be psychosocial.
Okay.
The physical factors include heat, light, soil, water, air, and some of those factors in the environment can negatively affect health. For instance, if you have soil that is contaminated or polluted with contaminants, and these may be microorganisms or disease-causing organisms, and you get in contact with that soil,
yes,
it can negatively affect your health, and so environmental health looks at that point. If you have air, air is supposed to be clean without particulate matter that can negatively affect human beings. But if your air gets polluted or contaminated, and you keep on breathing it, then you are exposing yourself to those factors in the air that can affect your health. It can be water. We interact with water in various ways. We drink water, we swim in water, we bathe with water. So if water is supposed to be healthy and clean, so if water gets contaminated or polluted for that matter, and you get in contact with it or you consume it, then you are exposing yourself to conditions in the environment that are likely to lead to ill health. Then it can even be electromagnetic waves. If a person, for instance, spends a lot of time under high electric voltage power lines, now those electromagnetic waves can negatively affect the health of that person. It can be a poor ventilation in a building like this one. If we are inside a building and you cannot have that free exchange of fresh air with vitiated air or polluted air, and you keep on breathing the air that you've been breathing out, you breathe in what you've been breathing out, the purity of that air is compromised and the quality of that air is compromised, and it affects your health. So all those things deal with environmental, look at environmental. They may also be things that we eat, food, and that is a very big component of environmental health. Okay. Food hygiene. The food that we eat on a daily basis has to be clean. It has to be suitable for human consumption. The moment it ceases to be suitable for human consumption, then it is dangerous to your health, and environmental health deals with that. So environmental health is that field of public health that looks at those factors and is responsible for ensuring that they are maintained in order. It's responsible for ensuring that nobody consumes contaminated food, nobody consumes contaminated water, nobody gets in contact with contaminated water, nobody gets in contact with contaminated soil, the aspects of waste management, human excreta. All those are issues that environmental health professionals deal with to make sure that they are in order. So in a nutshell, that is environmental health. It is broad, it is wide, as you can see, and there are cadres or professionals who are responsible for ensuring that no human being or no human being's health is affected by those factors in the environment.
Okay.
I hope I've made simplified
Yes.
environmental health.
How the things surrounding us may affect our well-being.
Exactly. Exactly. Indeed.
Those that we use, those that we consume, those that we cannot avoid live with, how suitable are they for us to live with?
Exactly.
Okay, we now understood. So we now move on the same page. I'll come to you, Dr. Herbert. How is environmental health structured for service delivery? We now know what it is.
Yes.
How is it structured for service delivery?
Thank you, Mako, and thank you, David, for elaborately explaining the concept of environmental health, which probably many people don't understand. But now, since now we're pushing it to the public,
Yes.
they will everybody understand it. So the structuring of environmental health is broad, like David has said. But before I speak to the issue of structure, allow me to just add one or two words to that concept of environmental health and why actually we are concerned about it. And we spoke to the issue of environment and people. And so people are part of environment. What surrounds us? You remember how we used to define environment
Exactly.
when we were growing up in our primary.
surroundings.
Man and his what?
And his
Man and his surroundings.
Exactly.
So in other words, what we do and how we do it is all environmental. And so now we add the word health.
So in those factors that David talks about,
Yes.
human beings are also
A
factors.
part of the factors, yes.
Okay.
So the people, in fact, when you are looking
My
at
ill
the-
health will affect you.
Exactly. So the entire ecosystem of social well-being is composed of people and the environment they live in. In fact, if you contextualize it further, you look at even development, because development, if you remember the sustainable development pillars, has the three. There are three. It has people, it has the environment, it has the economy. So economy is the money.
True.
And so you need money to survive. You need environment to survive. Environment might not need you, but that interaction is what makes the survival possible,
The chain.
the chain.
Yes.
And so it is important that the context of environment has to be looked from the lens of health itself. Because whatever we do, people who protect the environment, even the conservationists themselves, the reason they do protect the environment, the ultimate objective is to ensure a health population. And I think he spoke to the whole range of issues like water, safe air, safe food, you know, all these things. If they are safe, it means that people are going to be safe. And so we have a range of cadres across the spectrum of environment health service delivery. So we begin with the national level, for instance. The Ministry of Health has a full-fledged department of environmental health, which actually I head as the Commissioner of Environmental Health. And within that department are several staffs. We have divisions, we have staff that support national level environmental health interventions like policy, coordination of the sector, prayers, up to local government level. Now, so the aligned ministries like Ministry of Water, Ministry of Education, Ministry of Health itself, Ministry of Gender, especially those who are composed under the Human Capital Development Program. So we are largely responsible for ensuring the policy oversight, but also coordination of the different partners, because the environmental health is also structured within the development partners interventions, and also other implementing partners. And so we do national level oversight, but also we support compliance, we support mindset change, awareness creation, all those things that ensures that the environmental health is well delivered to the last mile. But when you look at the local governments, there are also cadres who are very structured, and I think that's our main conversation tonight. Because today we did launch the key performance indicators and targets geared towards supporting the cadres within local governments to ensure that their job is made easier. They have their job descriptions, but however, we are finding challenges in performance, we are finding challenges in reporting, and so we simplified their work by ensuring that we have smarter, simplified deliverables through a development of the key performance indicators. So those cadres are right from the district level, all the cities have them, up to the village level. They are structured up to the village level with the last person called the health assistant. Now below the health assistant, government thought that using the concept of parish development model, for instance, we needed people at the village level, and we still established those ones, which we call them VHTs. I hope you have heard about that. Definitely. VHTs, village health teams.
Exactly.
So the village health teams are the last male service delivery cadres.
Just to cut you a little short.
Yes.
What are your findings about the barriers that stand in their way of effective delivery?
The barriers are, they cut across, not only in the cadres of environmental health, but in the entire health service delivery value chain. One of them is limited resources, for instance. So they like to deliver a lot of things, but the budgets are constraining. And so, but this is the same across all the government ministries and departments. But the other barriers you can speak about is the mindset change or mindset problem. Because we speak about, for instance, performance, where some cadres actually do not live up to the expectation. Either they are cheating government time, so attendance to duty is really wanting. People work fewer hours than expected. They also probably do not do the right job. Others probably are not well trained. Even those who are trained, probably deliberately by omission, they don't deliver. So the mindset change is one of the challenges that impedes effective delivery of service. So these cadres are affected by several other challenges, but I think the biggest challenge is the right attitude. The right attitude to work. Because, for instance, today as we were exploring a number of things, we discovered that the money may not be the main thing you need to deliver a service. Do you understand me, Mike?
I am hearing.
Yes, because we looked at a number of things. For instance, you got the performance in different districts. You know that the districts that are well resourced may not be necessarily the best performing districts.
And those that have
limited resources
gaps,
may
scoring
be
high.
Meaning that even when you have the resources and you don't have the right amount, the right cadre, you may not deliver the service. You may not receive the service that you desire to have.
How do you generate these cadres? How do you recruit them?
The recruitment is the same across the public service doctrine. They are hired. They are competent. They are hired. However, just like any other ministry or any other department, you have some people that do not live up to the task. However, it requires regular engagement, regular skilling, because now we are living in an era where so many things are changing. For instance, now we are digitizing the entire health system. So if you have a cadre who doesn't know how to use a computer, for instance, it means that you're not going to receive the right amount of information that you desire to have.
Okay.
Yes.
I can see here you have the current human resource for environmental health.
Yeah.
It is a total of 5,132.
Yes.
Is that national?
That's national.
Okay.
The environmental health cadres are required by law to be registered under Allied Health Council. So the council regulates them and registers all of them. So that number actually now reflects the number that has officially registered. So there are those probably that are there and they have not registered with the Allied Health Council.
Those of us in the villages.
Yes.
How much do we know about this notion of environmental health, and do we really know the role of these people amongst us?
The role
Could that
of
be a barrier for these people to deliver?
the word environmental health is not a very old concept actually in Uganda, and actually globally. We have moved from the name, with the name that we're more familiar with actually is the environmental, the health inspector. Many of you, even as you're getting born, you found these people in the community, the health inspector.
Okay.
They had different names that have evolved over time. They used to be called sanitation orderlies, and eventually they evolved into.
So it is the changes that come with the situation.
So they remained, the name health inspector remained, but because now, by that time, they were either certificate or diploma holders, when we got the bachelor's level, we got now what we call environmental health officers. So these health inspectors are still available, and the registration actually looks at health inspection as a practice. So even when you have a degree, you might be registered as just a national health inspector.
Okay.
Yes, so the cadres in the villages are known. The Musao, if you remember the people that are in the villages, they know them as
The
Basao.
bicycle and the box. The bicycle.
Yes,
In
the Basao,
village. Yes.
those people who are normally responsible for Burunji Wansi, checking the quality of the food, checking the road, the small community roads, the Mayumba Kumi, if you remember the concept the LCs used to look at, ensuring that the abattoirs, the meat, the slaughterhouses, the function that was looking generally at hygiene in the community was the function of the health inspector. It still is. Although now we have seen the cadres grow in number, but also in career up to PhD levels.
Okay.
Yes.
I can see key strategic interventions here at the level of policy.
Yes.
How are you coming in to solve probably the gaps that you talked about and the barriers that we were talking about? I can see policy and regulation, capacity building and mindset change, routine health inspection and compliance assistance to the public health standards, supporting emergency preparedness.
Yes.
So at those different levels, how do you come in?
So
Are you handling us, the people in the villages, or these guys of your own?
Yes, essentially the ministries of health, law, together with the other line ministries, and our partners, development partners and civil society organizations, is to provide oversight. So we do develop policies, we develop regulations. For instance, we have just amended our Public Health Act just about 2-3 years ago. So we have a new act that really is very, very well enhanced and reinforcing the entire doctrine of public health. And so we are mandated to ensure that this law is put into action by developing a number of standards, a number of policies, rather regulations to support the execution of the public health interventions. And so we ensure that we cascade this practice through the existing structure. So the structure is there, looking at the Ministry of Health, looking at all the other line ministries to ensure that the law is in place. But also to ensure that we recruit and ensure that the cadres are, because all the commissions that are responsible for recruiting somehow have a linkage with the Ministry of Health to ensure that we fill those positions. So we put them in place, we supervise them, but also we continuously provide mentorship. Because, as you know, many things keep evolving, and so we continuously mentor them. When you look at the health facility, for instance, people who are supposed to support the health facility to prevent disease require a all-round approach to ensure that on a daily, they understand their job.
There's a technical one here before I go to David.
Yes.
Climate change and health.
Yeah.
So how do you technically handle climate change?
Yes,
as an environmental factor?
Thank you, Mick. So climate change, again, is another cross-cutting factor or issue.
Yes. But as an intervention? So
as an intervention, for instance, you first of all, before you look at it as an intervention, you look at the problem that it's causing. Right now, we are speaking about Buramburi, where we had the landslides with almost 40 people dying, 100 people are missing, over 3,000 people have been displaced and now living in a camp. So that's a climate change issue. And so because of that, we've had a lot of health infrastructure being washed down. And the upper catchment of Ramburi, we are going to actually abandon almost 20 health facilities So abandoning meaning that all the people who are accessing health are not going to access it because of climate change. We've seen wash infrastructure like toilets being washed down. What that means is that all the fecal matter has entered into the water source, the water sources. And so people are grappling now with the potential outbreak of cholera, dysentery, etc. And so climate change impacts directly on health.
Yes.
This flooding that you see in Teso and other areas directly impacts on health. And so the disease outbreak, when you look at cholera, for instance, it's the third killer in under 5s, the children below 5 years. The biggest after malaria, it is actually cholera. Cholera simply means eating directly the fecal matter. And so that contamination, one of the biggest problems is climate change that impacts directly on water, on environment when there is flooding. And so as the Ministry of Health, we have developed a national climate change and health adaptation plan, which is looking at really addressing impact of climate change on health. And so we are working together with the line ministries and development partners to provide resources to ensure that we address some of these impacts so that we can have resilient health systems across the country.
Okay, I am still with you. So what is the current state of environmental health indicators within the country? So, I think you should first give us a picture of what the indicators are.
Yes.
Then we look at their state.
So the state of indicators, it's not a very interesting state. The only promising thing is that we have moved from the worst. For instance, the status we are talking about water access, for instance. Okay. We are talking about sanitation. We are talking about the disease burden itself. The disease burden, we are talking about preventable causes like malaria, cholera, dysentery, neglected tropical diseases like trachoma, jiggers, the things that are even ashaming to speak about. True. So the indicators as we speak are not very good. When you look at the national coverage for sanitation, for instance, it's about 30%, what we call basic. And sanitation, we are talking about basically latrine facilities and how they are used. So nationally, basic means at least you have a decent place where you can actually visit. 30%. I mean, you look at any form, there are many. Each household has some form of a pit. Somewhere. And those ones maybe are 90%. But that pit really is not safe. It does not prevent disease. So we are talking about having a decent...
Having it and having it in a stable state.
It's washable. You can clean it. You can, even if it's not flushing, but a decent, safe place where you don't expect anything to come out and cause pollution or cause whatever. Secondly, the access to safe water is also not any better. We are looking at overall probably 80%, but when you look at health facilities in the hospitals where the major concern is, we are talking about less than 50%. Safe access to safe water. That means that now somebody who is going to give birth, a mother who has given birth, is going to have very big challenges of an hygienic state. They have to breastfeed, they have to wash, they bathe their babies, and so in the process, we've got a lot of hospital-acquired infections. People come to seek medical care, they pick additional problems. And so that is a big challenge. The other issue is, for instance, waste management. Waste management, in Kampala alone, if we just look at Kampala, we have proper collection disposal, up to the disposal level of less than 40% of what is collected. That means that the rest of the 60, we are living with it. It is on the streets, it is dumped in the fragile ecosystems like wetlands. It is around, it's all over the place.
Yes.
When you look at open defecation, I had spoken to this area. We have, in towns alone, about 9 out of 100 people are openly defecating.
In towns?
Yes, yes, yes.
Unbelievable.
And here, when you go to places like Karerwe, Baise, especially the mushrooming slum areas, people are using all sorts of means to deposit their fecal matter, using cavera and whatever. But also in the villages, we still have 16 out of 100 people doing it their way in the bushes. What that means is that directly finds itself in water. The next thing, they are the same people drinking.
A colleague here did a story and even won an award in one of the communities in Uganda, where open defecation is still looked at as a cultural thing.
Yes, yes.
At some point he interviewed somebody and asked him, so when you go to the banana plantation, when you come out, do you wash your hands? And the gentleman answered, we are not Muslims.
So it's a practice in some areas, and so these issues are not really better. When you look at menstrual health and hygiene, we call them pads.
Yes.
Our children, girl children are really suffering. Some of them have to leave school because of that hygienic issue, and so it affects the education, it affects the school enrollment. And so the status, so when you relate that to the burden of disease, it is big. You look at malaria, every day we lose about 54 people.
Yes.
Every day, single day. And malaria is an environmental health challenge because you have to have a clean environment. You have to have no stagnant water around your home. You must clear your bushes. Yes. And so the environmental components are the ones that are still keeping malaria with us. And you can mention it. So many other diseases I mentioned, these obvious things that in some areas that you wouldn't even expect to see, like jiggers. The jigger in this island age, we still have some jigger. I don't want to mention some regions, but you know, obviously some regions where we have still a problem with jigger. That's a hygienic issue.
Okay.
Yeah.
Why the key performance indicators, David?
Yeah, thank you very much, Michael. Key performance indicators, first of all, are units of measuring performance. And in Uganda, Uganda is a country that is in a state, in public health we call it an epidemiological transition. When you look at the health indicators in different countries, there are some indicators that can be attributed to countries in the high income, which we call the high income countries. And then there are other health indicators that can be associated with low income countries. In low income countries, you would expect that majority of the diseases are the communicable diseases, these diseases that can be acquired from one person to another. Those are diseases of poverty, if we can say. Dr. Herbert has been talking about them. Diseases like trachoma, for instance. Those ones, people get them because they have limited access to water for washing their faces. Diseases like dysentery, where people have inadequate access to safe drinking water, and usually these are the poor people who have those diseases. So in low-income countries, you would expect that you have majority of the illnesses as being communicable diseases.
Okay.
Now Uganda is in that state of transition.
From low-income earning?
Well, let me not talk about the socioeconomic indicators, but as far as health is concerned,
yes,
we would expect that Uganda, being a low-income country, to be having those kinds of diseases. They should have been the majority.
Okay.
But it is in a state of transition where people are now, many people are going to hospitals as a result of non-communicable diseases. Some of these are lifestyle illnesses, others are environmental illnesses but not communicable. Things like cancers, things like high blood pressure, things like, those non-communicable illnesses.
Yes.
Now, indeed, the bulk of the diseases that we have in this country, 75% of the diseases that we have in this country are preventable. And incidentally, many of them are related to the environment. they are environmental health related. All those diseases that, you mentioned them, the ones that you commonly know, the ones that people commonly take to hospitals, even people who are going to hospital tomorrow. I know a person may be suffering from malaria, and it is because they allowed a stagnant pond or a pool of water to breed mosquitoes from where mosquitoes come in and bite them and then transmit the malaria parasites to them. Now they will go to hospital tomorrow, and yet they would have prevented that disease.
By clearing
by clearing, just draining the swamps, draining the stagnant pools of water, cleaning your environment. The flies that we see that transmit the diarrhea, dysentery, and cholera, those flies can be kept away if you maintain your household clean. Now, there is a cadre, and these are the professionals who are expected to be doing this on a day-to-day basis. These are the health inspectors, the health assistants, and the environmental health officers. Now, yes, those levels, Dr. Herbert has talked about them. But these are the people, the community health workers, who are expected to do that and to support the communities to fight against those illnesses. In fact, if all these cadres were doing their job well, it's unfortunate that sometimes the wage bill of district local governments is low and they cannot afford to recruit as many as they ought to have recruited. But if every village, for instance, had a health assistant, and that health assistant is moving from door to door to ensure that your house is clean, your waste is managed properly, you have proper drainage, you have proper excreta disposal facilities, the feces are not littered, you are drinking safe water, you are preparing your food and eating it hot. If every village had a health assistant and they are doing their job properly, trust me, the wage bill of the bill of medical expenses to the households or to the communities would drastically fall.
Go down.
And also the burden on the economy of the country would also go down. As a ministry, the Ministry of Health as government, I know the strategic direction that the ministry is taking is the preventive side. After all, prevention is better than cure. That has been said, it is being said, it will always be said. So prevention is better than cure. Now, these cadres for whom these key performance indicators have been developed have been working for a very long time, and it was difficult to measure their performance. Well, if a person is in a clinical setting, you can measure how many clients, how many patients have you seen, how many patients have you interacted with. If you are in the laboratory, you can easily measure how many patients have you diagnosed, But for the environmental health officers and those staff, because they are out there in the field, it has been difficult to measure their performance. And yet, the country is taking that direction of prevention being better than cure. And these cadres are the frontline workers of the ministry who are expected to implement that strategic direction of the ministry. And so, the development of these key performance indicators for this cadre comes in handy.
Okay.
We will now be able to know, of course, we know the number of health inspectors, health assistants, and environmental health officers. We know how many there are in this country. And we will now be able to task them. How many premises have you visited? How many premises have you inspected? How many nuisances have you abated? That's the technical word that we use, abatement of nuisances, dealing or doing away with nuisances. And nuisances are those conditions in the environment that are either injurious or likely to be injurious to health.
It's not the other literal meaning of ours.
No. So the statutory nuisances that you have abated, how many are they? How many people have you served with notices? Because the work of environmental health officers is basically law enforcement. Okay. So the number of people, how many people have you taken to court, and how many have you prosecuted successfully and have come back to abate the nuisances? So now, these key performance indicators are to help, especially the district local governments, who are the main employers of this cadre, to support, to track, to support the Ministry of Health to track the performance of these people. And it should be able to show when government seriously comes in to track the performance of these health workers, there should be a relationship between the number of diseases that have reduced, because ultimately,
In that particular area.
in that particular area,
Yes.
you should be able to say that this health assistant who is in this village has, with their interventions of walking to the homes to ensure that the homes are kept in a healthy
Here are the
and
results.
sanitary environment. These are the results. We should see a decline in the number of communicable diseases. There should be a decline in OPD attendances. People should not go to hospitals. There are some illnesses actually that are laughable. And I know I usually joke around with people. There are some people, especially in the villages, and you know, sometimes when you suffer from typhoid fever, and the medication that you're expected to have, you sometimes take it over a series of 5 days,
Yes.
and it is IV or intravenous. It has to be taken in through the vein. So they insert a cannula on your hand, and you move with it. Now, there are some people in the villages there who find it prestigious to walk with a cannula. And I don't know how they came up with that. And when you ask them, hey, what's happening? What's the problem? They somehow prestigious, typhoid, as if it is prestigious. Now, there should be a decline in some of those OPD attendances, and hence the development of these key performance indicators for the environmental health professionals. Otherwise, they'll continue working day in, day out. Some of them, and I must say, some of our environmental health professionals, the health inspectors especially, some of them visit eating places or food places, and they find that they are not suitable for fit for purpose. But they do not take the responsibility to do what they're supposed to do of the role of enforcement of the law. They should prosecute people who are still
Running these operations.
running these businesses in filthy environments. I know there are many challenges, of course. We can say Ugandans are now lawless. The low levels of lawlessness are high, but that should not deter the enforcement of law. And incidentally, there is goodwill. And the people who are out there in the country, if you are there and you have a neighbor who is selling you food, or even in supermarkets, I know there is a tendency of people selling expired foodstuffs in supermarkets.
Yes.
These environmental health officers are expected to visit those supermarkets and impound those foodstuffs that are being sold as in a state of expiry.
I have an observation. Do we, the public, know all this? And do we know the power of that team as the public? Does the team itself know that they actually wield a lot of power to do all that you are actually suggesting? Because indeed, if it really happened that they were doing that kind of work effectively, really there would be a lot of results everywhere.
Indeed. And now in this studio, actually, you're the one representing the public.
Yes.
I don't know whether they know, and you should be telling us whether they know. But as far as we are concerned, as the professionals,
Yes.
for us, we know that our professionals know what they are supposed to do, and these professionals are they are now found within the urban centers. They are found at the local government levels, the town councils, the municipal councils, the division councils, and then in the rural areas, they are found in health facilities and at sub-counties. So the health inspectors and health assistants and environmental health officers, you ladies and gentlemen in the community, those are people who are supposed to protect you from some of these ill conditions. And you should demand.
Time
that
is
they
running,
take
but
that.
take an example of the urban centers. You will find people owning plots of land of 30 by 20 feet. Someone's pit latrine is facing the other's entrance. The pipe of dirty water from someone's house is again running between other people's houses. A situation like that. I think, according to what you're saying, these are things that would call for the guidance of this team to ensure that we don't see it happen in the communities.
Indeed. The Public Health Act actually specifies all that. And there are rules or regulations that govern that. The current amendment of the Public Health Act removed the mandate of supervision of building construction from this environmental team. But prior to that, the health inspectors had that mandate of ensuring that because they used to scrutinize building plans before building plans are approved for construction. The law that we have, the current law that we have, the minimum size of a plot for building construction should be 50 by 100 feet. Okay. The 50 by 100.
Standard.
That's the standard. But these ones of 20 by 30, those are not standard plots. And whoever is authorizing people to construct in those places is doing a disservice to this country. Because with that kind of arrangement of a plot, surely having a latrine next to someone's kitchen is inevitable. But, and now I would like to implore our colleagues in the district local governments who are responsible for building construction. I now know that the Buildings Control Board is functional, and I would like to encourage you to refer to those old laws that were actually made to protect public health. The minimum size of a plot should be 50 by 100, and to make even matters worse,
yes,
that law, the construction, the area that you need to construct on that plot is only 25%. So if you have a 50 by 100 plot, the best you can do is to construct your building going up in order to get all the space that you need.
Free.
But now, a person gets a plot that is 50 by 100, constructs a big house along it, almost fills the entire plot, and there is no room for other amenities. The septic tank has nowhere to discharge, the pit latrine has no space. So the challenges are many, and these health inspectors, and now I would like to implore you, our environmental health professionals, wherever you are in this country, you still have a role to play to protect public health, to protect environmental health, to protect the public, the health of the public from these deteriorating health conditions. So this is the significance. So the role, these key performance indicators will come up to make sure that this particular cadre, these are cadres who are supposed to be out there in the community, doing their work on a daily basis.
Effective.
Many of you are not seen in the communities. I know people are complaining that they are no longer seeing these health inspectors, they are not seeing them. People who have been living on this earth for some time now, they know that those days they used to see a health inspector who would come either on a bicycle, with a white clinical coat, with a notebook, and they would check for everything. They used to
actually, what happens in the communities is what tells that these guys are not at work.
Yeah.
Let me go to Dr. Herbert here. We have a few minutes to share. What is the scope of these KPIs, Dr. Herbert?
Yes, Mike. The scope, actually, we've been singing it since we started this conversation.
In the discussions, we have been hinted on it a number of
covered
times.
it. But just to recap, one of them is health inspection, as the name suggests. So these guys are literally supposed to ensure that there is sanity across board, be it an eating house. The people who serve us food must be medically examined. So the cooking area, if you take, for instance, Kampala, we all understand the status of food, especially outdoor food. I'm not referring to the main hotels. During evenings, people now turn the roadsides into cooking places. They become hotels, mini hotels. So you see people literally serving. You wonder where's the source of water in that place, where's the toilet, to the extent that even there are people cooking along the drainage channels, if you just really bother to move around. And then they are washing
because
plates.
If every road has a drainage channel,
yes,
and these people cook on roadsides.
Exactly. So to the extent that some people are even washing utensils in some of the running water, which is fecally contaminated. So no wonder we have a lot of some of these disease outbreaks like cholera. So they mandate, one of the core mandates of the health inspector is health inspection. And health inspection across all the public health spaces. Markets, eating places, abattoirs. You remember the meat we eat, if you go there, you'll be surprised. You may not eat it.
None of us is safe.
Yes.
When you mention markets,
yes,
and abattoirs.
Yes.
You drive around Kampala these days after the Chitezi incident.
Very, very challenging. It's very challenging. So the role of a health inspector is to ensure that they ascertain suitability of all those places. The other one is ensuring proper wash access, safe water, safe sanitation, safe hygiene, in every corner of the environment.
What other strategic interventions are being undertaken to improve the health service delivery?
So strategically, we are much as we are supporting local governments through these key performance indicators, but the ministry and the line ministries, we are not seated. For instance, I told you that we have a new law, which is more, this time, very stringent.
Okay.
So we are looking at operationalizing the new law through developing different regulations. One of them is, for instance, waste management. We are right now working with KCCA to see how the problem of waste can be solved.
In Kampala?
In Kampala. In all the cities, including Kampala.
Okay.
The other is we are looking at high-level engagement, and we have developed a number of studies that actually explain the whole burden. For instance, we have done a study called the cost of inaction. What does it cost the country if you do not act to provide right amount of water, proper sanitation, proper hygiene? And actually, we have discovered that the cost of inaction actually on wash itself is about 4 trillion. 4 trillion. By not acting, we are losing about 4 trillion. So what the country needs to do is to fix those challenges through the right resources, through the right right roles and actual performance, such that money which we are losing in treatment, I am talking about real money that is going into treating malaria, treating cholera, all burden of disease, like David mentioned, 75% are preventable. So 4 trillion is going because of lack of action. So when we do the right thing, then we can now reverse that money into the actual money, other meaningful interventions. And of course, the research has also shown that the returns are high. For every $1 that you put in public health, you save $10.
Okay.
You get the point?
Yes.
Yes.
David, what is the role of civil society organizations' involvement in enhancing environmental health services delivery in the country as we wind up?
Okay, as we wind up.
Yes.
Civil society organizations, first of all, to our dear viewers, civil society organizations are the organizations that are non-governmental in nature, or we normally call them non-government organizations, NGOs. Non-government organizations, whatever they do in this country, they do it on behalf of government. So they are there to support government. They do the work that the government should have done to provide services to people. So now whatever we do as civil society, we are expected to be strengthening government systems. And I think that is very core. That's a cardinal role of any civil society organization of goodwill. If you are doing something and you are doing it, you're the one doing whatever you are doing without due consideration of what government should be doing, then I think you are not in the good direction. So strengthening of government structures is one of the things that civil society organizations ought to be doing. Strengthening structures, supporting the government, supporting the Ministry of Health in this particularly, to make sure that you either empower these environmental health people wherever they are, because civil society mainly works in district local governments. So those health inspectors and health assistants at every level, we as civil society, we support them. They have a challenge of transport because a stethoscope to a clinician is the transport means to an environmental health professional. And many of them have no transport means. So you find that they are restricted in their movement. No wonder they are not being seen, although that should not be an excuse for having no transport, because even the areas around them,
still there is no work done.
Not much. We don't say no work done. There's work done, but probably not much.
Okay, there are signs of their absence.
Exactly. But they would have probably performed better if they had access to reach all those other premises. So the civil society organizations can come in and provide that kind of support and empower those professionals, because the civil society organizations do not enforce. Enforcement is the work of government.
Yes.
So their work is mainly to support these enforcers to do their work.
Thank you so much, David. Just a closing remark in a sentence.
As a country, we have just launched these key performance indicators for environmental health professionals, and we think that is a move in the right direction. So the environmental health professionals countrywide, wherever we are, we have an opportunity now to show our relevance in society. And so let's stop hiding away and shying away from our responsibility, but let's take the bull by the horns and stand up to be counted. This is an opportunity for us as environmental health professionals to shine and to show our relevance in society.
Thank you so much. Dr. Nabasa, as we wind up, just a short
Yes, just to echo what David said, is that the subject factor is largely around performance. And so performance can have a lot of challenges, resources, and etc. But we are saying let's have the love for our country.
Okay.
Let's have a mindset change that is geared towards really self-love. So if you do that, even when you have limited resources, you'll endeavor to deliver, because if you don't do that, next time you don't know who's going to fall sick. It could be your mother, it could be your father, it could be your son, your child. So let's get out of our comfort zone and be able to use the national level guidance, use the policy that is available, even when you have limited resources, and we are able to perform. But also to ensure that, now this is to the general public, that much as we have the cadres or the professionals, the public health is an individual responsibility. We must take it in our hands.
Because it is our health.
It's our health.
At the end of the day.
Nobody, you cannot really delegate it.
No one will die on your behalf.
Exactly. It is you. So make sure that you, personal hygiene, sanitation, boiling water for drinking, ensuring that you don't have bushes around you and then you die or your child dies from malaria. All these are things we can do and they are doable.
Thank you so much.
Personal responsibility is very key.
Thank you so much, Dr. Herbert Nabasa. He's the Commissioner, Health Services, Environmental Health in the Ministry of Health. And at the far left is Mr. David Katwere Semwanga. He's the Programs Manager, Water for People. That's the discussion we had about environmental health. The surrounding where you are has a lot to do with your health. So what is it like is the question. The answer tells you what to do. My name is Michael Jordan Lokomwa. The priest has to give us news. Let us give you room to watch it. Bye-bye. Thank you, gentlemen.
Thank you so much.
You're welcome.
UBC, inspiring Uganda.